Hey, welcome. This is April 29th, 2026. That's not correct, is it? It's all coming down. That's pretty close, right? That's pretty close. It's what we got, right? It's what we got. Hey, I'm Dr. Otto Janke. Welcome to the weekly webinar. Let me fix my camera right there. That is the boy with a jetpack. That's who I am. I'm a boy with a jetpack. No doubt about it. Welcome to the weekly webinar. And there's a couple of things I want to dive into tonight. Read a very, very interesting article. Let me pop it up here. Very interesting article. It was on kevinmd.com. MedPage today's kevinmd.com. Social media's leading physician voice. Article from April 26, 2026 is why the U.S. needs more preventive medicine and public health doctors. And my answer is, really? Because the first question I have to ask is, how have we done so far? How have we done so far? Great question. How have we done so far? Preventive medicine is the practice of preventing disease, disability, and death at both the individual and population levels. It aims for the absence of disease. The absence of disease, either by stopping it from occurring or halting its progression after it begins. My first question is, do you really think you're going to stop disease? Do you think you're really going to stop bugs? Bugs that are just super more intelligent at doing what they do. And we don't allow ourselves to do what we do best, which is defend against the bugs. We try to interfere with that. 3 levels of preventive medicine. 3 levels of preventive medicine. First is primary prevention, which is prevent disease before it starts. Examples are vaccines, nutrition, exercise, anti-smoking, and anti-smoking campaigns. I could do a quick talk on the vaccines. How have we done so far with all those? The classic is the common cold, flu. Nutrition, exercise. We're actually going to bring that up. How have we done with that? Terrible. If the primary prevention tier is examples of that are vaccines, nutrition, exercise, and anti-smoking campaigns, how have we done with the 2 biggest ones, which are nutrition and exercise? And the real answer is terrible. Absolutely terrible with that. Secondary is detect disease early. Examples are screenings like blood pressure and cancer tests. Tertiary is reduce complications of existing disease, rehab, chronic disease management. I'm going to jump in a little deeper into this one. Because this kind of was very, very interesting for me. Because, first of all, you would think that I would be a classic person for preventive medicine. I'm a doctor of chiropractic. No, I do not have an MD at the end of my name, but you would think I'd be the exact person for this. And my question has always been, does preventive medicine actually prevent anything? Does preventive medicine actually prevent anything? The long answer is it's highly effective for infectious disease, environmental hazards, and acute risk reduction, but much less effective for the big one, chronic disease. What I find absolutely astounding in all of this, does preventive medicine prevent chronic disease? The evidence-based answer is not effectively, is really no. If we look at cancers and cardiovascular disease is the #1 killer of Americans. Cancer is number 2. Cardiovascular disease, number one. Cardiovascular is number two. Those have been the number one and number two killer of Americans for freaking decades. How has preventive medicine addressed those? There's still hundreds of thousands of people who die each year because of those. And they're saying, well, we're winning the game against because we have early detection. And the answer is, really? So I find one of the biggest problems we have with preventive medicine is that they miss a big, big boat. They miss a big boat. And the one place that preventive medicine does not address nearly enough is the nervous system regulation. Nervous system regulation. How can we get the body to not prevent stress, but to adapt even better to it? We try to run away as much as possible from stress. Don't try to run away from stress. Have your nervous system adapt so well that the stress itself is no longer a problem. Are you going to run away from? So I always use the example of this. If it's raining outside, what do? You get a bigger umbrella or you wear a rain jacket. You don't try to run away from the rain all the time. You adapt to it and make it no longer a problem for you. We don't do that in healthcare. We don't do that in healthcare. Why don't we, instead of trying to prevent these things, and this is the question I have often. The question I have often is, we should not be asking the question of what's wrong and how do we prevent it. Instead, the question we should be asking is, how can I help you to be so healthy, so strong that those things are no longer even a problem? Instead of asking the question of what's wrong and how can we treat it, why don't we ask the question on a regular basis of how can I help you to be so healthy, so strong that those things aren't even an opportunity anymore? We don't ask those questions. We don't ask those questions. One of the biggest things we would do is, if we are truly concerned about preventive medicine, if we're really truly concerned about preventive healthcare, we would have everybody have nervous systems that are first tested on a regular basis and then optimized on a regular basis. You can't do that with medicine. I've said this before many, many times also, is that as soon as pharmacology finds out how to test your nervous system and then adapt heart rate variability with medications, you are all going to be on medications. And it's not going to do a damn thing for you. We don't talk nearly enough about lifestyle and how more and more people, here's reality, is that I have people asking me in my practice on a regular basis, what can I do outside of here to be good? And so what they're really asking me, let's be just totally honest with this, what they're really asking me is, what can I do outside of your office to make sure I don't have to come to your office? Okay. Well, it's not doing core work. That's for damn sure. It's not doing low back exercises. The very first thing I ask patients is, if you are truly don't want to come to my office, then do you exercise on a regular basis? Do you exercise 5 times a week for 150 minutes a week? We'll say, well, I don't have that time. Then don't. If you don't have the time for that, great. Then cut it down to 75 minutes per week by exercising super hard, intense. Those aren't my guidelines. Those are done by the federal government. If you actually want to decrease the amount of exercise time you have, then you got to increase the intensity. I ask patients on a regular basis, are you exercising on a regular basis? No, not really. Well, we got to start there then. Well, I don't. We got to start there. If preventive medicine was really concerned about this, they wouldn't be suggesting exercise. They would, if preventive medicine was truly concerned about helping more and more people, they wouldn't be recommending exercise. They'd be demanding it. If preventive medicine was actually concerned about nutrition, they wouldn't be saying, we think you should do this. They would demand, knowing that the chronic diseases, that those two things, exercise, nutrition, are actually fundamental aspects of you decreasing literally all of the chronic diseases. Why wouldn't you just make that mandatory? Well, you can't make people exercise. You make people take medications on a regular basis. This isn't rocket surgery. It was never meant to be. It's not that hard. If we actually want to get people to be healthier, we have to give them a foundation. We start with a nervous system that's optimized. We test the nervous system on a regular basis, very, very simply with heart rate variability. Find out how well your nervous system can adapt to the stresses. If it can adapt better, then get a bigger frickin' umbrella. How do you do that? You build you so well that the stresses no longer affect you nearly as much. It's not that it's not going to rain anymore. Of course it's going to rain. But the raindrops don't affect you nearly as much. We start there. And from there, we build in the great sleep. We add in great motion, adaptable motion. We add in great rocket fuel. And then we add in mental rest and focus. When you have a nervous system that's optimized, when you add those things on, those things work better because this base is better. Why is it that some people can't eat certain foods? Because their digestive system is just shot. I had another woman in my practice today. Digestive system is shot. The number of people I have in my practice who have IBS, irritable bowel syndrome, and I'm not saying it doesn't happen, but that's just an umbrella statement for you have a digestive system that doesn't function correctly. And they're looking at you going like, no kidding. When you add in these other things, they function better. You get a bigger bang for you because the nervous system is functioning better. This ain't rocket surgery, folks. Get this nervous system functioning better. When you add these things on, they function better, so then you get a bigger bang from that. You want to talk about preventive medicine? We just did. Look forward to talking with you next week. If I can be of any help to you, give me a buzz. My pleasure.